We're going to demonstrate our onlay technique for lateral position arthroscopic biceps tenodesis. This is especially helpful when doing labor repair in conjunction. Here we're in the lateral position. You can see that we're using our spinal needle to find the appropriate trajectory, as we'll be placing the biceps back at the high portion of the groove. Once we found our spinal needle position, we use a switching stick and then use a 8.25 cannula with sequential dilation. Following this, we'll perform a loop and tack method. So we use a suture tape fiber loop. Again, we use a bird beak. We pass all the suture through. The looped end is already linked into the bird beak to allow for easier passage. Then we go around, grab the suture, and then we link the suture so it's cinched down onto the biceps tendon, as you can see here. Following this is called loop and tack method. We pass all the suture back into the joint, and then we'll use a bird beak to penetrate through the center. We'd usually go distal to the tendon to allow for a ripstop method, and then we'll grab that suture with the bird beak in, and then we will tighten it down, as you can see here, and we'll occasionally use a knot pusher if needed. We like to do a double loop fashion, so we pass the bird beak back in again intra-articularly, go through the tendon, and pull it through again for 2 cinch stitches. You'll see for us to fully tighten it, we'll use a knot pusher one more time, or a loop grasper here to act as a finger, and this reduces any more slack in the system. And you can see the biceps is still attached, and then we have a chance to remove it and use an RF to clean it up on both sides. Finally, we'll place a swivel lock right at the entrance of the groove, followed up using a punch, followed by the swivel lock. Here we're using a peak swivel lock, and this provides excellent fixation and biomechanical strength. Finally, we loop the stay stitch around the biceps, and here we're sequentially tying it down for secondary fixation. Again, the data has shown that this is equivalent biomechanical strength, this loop and tack fixation, to crack out stitches. We've had good success with this, especially in patients in lateral position with concomitant labor repairs.